if you work in public health, you'll notice that there's like a lot of dental indices that are used. And it's important to be familiar with the many different types of dental index or dental indices used. So basically, when we're looking at dental indices, it's just a standardized method that's used to describe an oral condition, and they describe it in numbers. So we're going to look at many different types of examples of dental indices which is a method that is used to describe an oral condition of one person or of a population or of a group, and it's used in it's numbers. It is dental indices will always give you a number at the end. So there's many criteria for a good index, for an ideal index, and you want it to be clear, so it has to be easy to understand. You want it to be simple, so it's easy to apply. You want it to be not ambiguous, so objectivity. You want the index, the criteria listed, to be very clear and objective. You want it to measure the intent. You want to measure what it is intended to measure. So you want it to be valid. You want the dental index to be true, to be realistic. You also want it to be reliable. So if I were to do the test, and then if you were to do the test, our results should be similar. You want it to be reliable, quantifiable. You want the data to be expressed in numbers. So as I was saying here, dental indices they're identified, or they're expressed rather, in numbers. Sensitive or sensitivity is basically where the index detects small changes. So there are some index that I'll go over that lack sensitivity, and then there are some that do that have great sensitivity. And basically, if you look at an index that only have two options for you to choose from, so for example, if you're looking at an area and it says bleeding, and you have to identify whether it's bleeding or not bleeding, that's when you have two options. Bleeding, you would say yes, or bleeding, no. And when you have two options to choose from, it detects, it's not as sensitive, it lacks sensitivity. But there are other indices that we'll look at that have many different options. They have 4 options that you can choose from. So when you have more options, it's able to detect small changes, and that is more, that is better in terms of sensitivity. And we'll look at that with examples. And then, of course, it has to be acceptable. The subject or your patient should not be in any harm. So let's start, before I go into the indices, let's start at looking at the Ramfjord teeth. And the Ramfjord teeth are basically 6 teeth that you see here. So the 1-6, the 2-1, 2-4, 3-6, 4-1, and 4-4. And what you want to keep in mind over here is that they say that if you just look at these 3 teeth and do your index or dental index based on these 6 teeth rather, then these 6 teeth are representative of all teeth. So what the findings that you will find in these 6 teeth will be very similar to the findings that you will find if you were to do the entire dentition. If you were to assess the entire dentition, the results would be very similar to just doing those 6 teeth. So sometimes we don't have time in community and public health to assess every single tooth. So instead, we'll just do these 6 Ramfjord teeth. And when we use a dental index that only use those 6 Ramfjord teeth, what will happen is we will say that the index is modified or simplified. So that name modified or simplified is added to the index. And I'll give you some examples of that as we scroll through. So let's look at the first. We're actually going to start with plaque indices. So there's many different plaque indices, and we're going to look at the first one, which is known as PHP, Patient Hygiene Performance Index. And see how it says here, Patient Hygiene Performance Modified? That's what I was referring to, that if I were to do the entire dentition, if I were to assess the entire dentition, I would say PHP. But if I were just to do a modified index where I'm just using the Ramfjord teeth to do this index, then I would say PHPM, M for modified. So you'll see that in this name of index, they'll add the word M or S, S for simplified, M for modified, to show that they only did it on 6 teeth as opposed to the entire dentition. So let's look at how you would do this type of index. So with this one, you give your patient a disclosing solution and you tell them to swish with it and spit it out after they've swished with it, and then you look at each tooth and you divide it into 5 sections or 5 subdivisions. So we have the interproximals, and then this is divided into 3. So let's try to figure this out. So let's say I assessed a 1-6 and there was plaque over here. So I'm going to color this in, and there was plaque over here. So the 1-6, this one, oops, this one gets a score of 2 because there were 2 surfaces that had plaque. So let's look at 2-1. 2-1, let's say there were 3 surfaces of plaque. So I would give this a score out of 3. And basically every tooth can get a score of up to 5. Okay, so it all depends on how much plaque they have, and every tooth can get a score of up to 5. Let's just hypothetically, I'm just going to throw out numbers here. This could be 2, this could be 5. Let's say 4-1 was really dirty and there's plaque everywhere, all around here. There's plaque here, here, and here, so I gave it a score of 5. And let's say 4-4 was also quite bad, so this is a score of 5 as well. So then what you do is you have to calculate it. So basically you add up all these numbers. So you take 2 plus 3 plus 1. I got those from here. 2, 3, 1 plus 2, I'm looking at the bottom, plus 5 plus 5. And you divide this by 6. So when you do that, let's pull up the calculator so that we can see what I'm doing here. So we're getting 2 plus 3 plus 1 plus 2 plus 5 plus 5. That equals 18. So 18 divided by 6. And again, you just go divided by 6, and you'll see you'll get 3. Okay, so what does this mean? Well, let's look at the interpretation. When you look at the interpretation, this one will tell you that 3 falls under this range over here, 1.8 to 3.4. So this person has a fair dental index, or fair, actually what I should say is a fair PHP, okay, or PHP-M, because we're using the modified. So this one would be considered fair. So we look at this interpretation to decide how they scored. Let's look at another type of plaque indices. So now we have something that says plaque control record. And plaque control record is when you're looking at how much plaque is along the gingival margin or along the gum line. And so you could use all teeth. So all teeth are examined. And what we do is we divide each teeth in 4 surfaces. So if we look over here, you can see that each tooth has been divided into 4 surfaces. If I were to zoom in, you'll see that it looks like this. So the distal, mesial, lingual, and facial, or facial and lingual, are all outlined here. And so what you do here is you look at the entire mouth, and you color in the areas that have plaque. So this area could have plaque on one tooth, and the mesial could have plaque on one tooth, and I color it in. And you can see, for example, when you look at this, all areas of the mouth or of the tooth have plaque. So that's why it's fully colored in. Whereas if you look at this one here, only the distal and the mesial have plaque. So it all depends on where you see plaque, and then you click on it if it's a computer system, and I'll color it in for you, or you would color it in. So let's do an example. Let's say, let's do this example here. And I know in this example they didn't use any molar posterior teeth. We're going to assume that they used the entire dentition to assess the plaque control record. So let's say hypothetically, I mean this is really rare, but let's say hypothetically that when you look at someone's mouth, you saw no plaque in the posterior teeth, but you saw lots of plaque in the anterior teeth. In fact, everywhere, the facial, lingual, distals, and mesials, they all had plaque. So how do you calculate the PCR? How do you calculate the plaque control record? Well, what you do is you figure out the number of surfaces with plaque. So let's actually do this. So over here we see 4 plus another 4 plus another 4 plus another 4 plus another 4. So 4 times 5, 20. And then here 4 times 5 again, 20. So I saw 40 areas. So you add up all surfaces of plaque. Here there's 4. 4 plus 4 plus 4 plus 4 plus 4 plus 4 surfaces, and so on. And you should get 40. So how many number of surfaces with plaque? 40. And then you divide it by the number of tooth surfaces examined. So let's say I examined all dentitions. I examined all 32 teeth. And if I examined all 32 teeth, then what you do is you go 32, and you have to times it by 4. And the reason why I'm timesing it by 4 is because there's 4 areas I'm assessing per tooth. So let's do this. So you got 40. 32 times 4 is 128. And then when you get that, you should get somewhere like 0.31. And then remember this, you times it by 100. So if I times this by 100, remember there's 2 zeros and 100. So you bring this out by 2 zeros, and you should get 31%. There you go. So this is your plaque control record, and the lower the percentage, the better. So if you have a low percentage, that means that your plaque score isn't that bad. But if you have, like, let's say you got like 90%, well, 90% means like 90% of your mouth is full of plaque, right? And that's not good. So the lower the percentage, the better. So that's how you calculate plaque control record. Now let's look at plaque free score. So plaque free score looks at which areas are free of plaque. So if I'm using the same example, okay, so I'm using the same example here. All you do is you take this number and you go 100 minus 31 and 100 minus 31. So you subtract it by 100%, right? So what I'm going to do is I'm going to go 100 minus 31. And that gives me 69%. And 69% is not, again, it's not so bad, because the higher the percentage here, the better. So, 69% of the mouth was free of plaque, was plaque free. So that's PFS, plaque free score. So here, the higher the percentage, the better. Whereas with plaque control record, we're looking at how many surfaces have plaque. So here, the lower the percentage, the better. Let's look at plaque index. So plaque index is another dental indices that looks at the thickness, so how thick plaque is. And again, as we look at it along the gingival area, and we do the same thing. We divide the teeth into 4 tooth surfaces. So we look at like the facial, the lingual, the distal, and the mesial. And what you do over here is you give each surface a score from 0 to 3. So for example, if I were to look at the molar over here, and let's say that on the facial side, okay, so on the facial side, I give this a score of 0 because there was no plaque on the facial side. However, on the mesial side, I did see a thin plaque layer. So in here, I'm going to give it a score of 1. And so again, when you do this, you could do the entire dentition, or you could just do some surfaces. So let's just look at the lingual here, and on the lingual, it was really bad. I'm going to give it a score of 3 because there was lots of plaque, abundant plaque. And then on the distal, let's do 1. It was just a thin layer of plaque. So you do this for all surfaces, okay? So let's just say here, I did this 115, and let's say I got a 2, I got a 1 on this side, I got a 0 on the lingual, and I got a 1 here. And again, I'm going to do this for all areas, and I'm looking at this guideline to determine how much plaque there is. So once you do all that, so again, I'm just going to hypothetically make up something here. Let's say there was a 1 on the facial, a 2 on the mesials and distal, and then a 1 again on the lingual. So you do that for all surfaces in all areas of the mouth. And then what you do is you total the scores for plaque and you divide it. And then you'll come up with a number. So let's say I add all these numbers. So 1 plus 0 plus 3 plus 1 plus 1 plus 2 plus 1 plus 2 plus 0 plus 1 plus 2 plus 1. And I keep going. I look at every single mouth. And let's say hypothetically, we're just going to throw out a number here. Let's say I did this for all areas and my total was, I'm just making up a random number here, 65. So when I totaled everything up, I got 65. That was my total score for plaque. Then what you do is you go 4 surfaces, so 4 times the number of teeth. And here we have 32 teeth. If your client has no wisdom teeth, remember to get rid of the wisdom teeth and then say that you would times it by 28. So it all depends on how many teeth your client have. Your client could have a tooth extracted, so be sure to take that number out from the total number of teeth. So we go 65 over 128, and then, because I'm not good at math, I'm going to pull up a calculator, and we're going to go 65 divided by 128 equals 0.51. I'm just going to round this up, 0.51. Now let's figure out what this means. 0.51, where does this go? This actually goes in this range. So this is actually considered good. So this person has a good plaque index because 0.51 falls under this range here, which is considered good. If the number was higher, let's say I got lots and lots of plaque and I was like at I don't know, 150 or 200 or whatnot, I would probably get a higher number. But because there was only 65 surfaces of plaque, when I did the math, it went to 0.51, which is considered good. All right, well, let's move on to the next one. So oral hygiene index. This is another type of indices that we should be familiar with. So with oral hygiene index, what happens is there's two components to the oral hygiene index. We look at how much debris someone has and how much calculus. So it's split into two. We look at a debris index and we look at a calculus index. And you can, look at them both together. If you add them both up, it becomes OHI-S, Oral Hygiene Index Simplified. And so let's do some examples here. So what you do is you look at 6 teeth, and these 6 teeth are not the Ramfjord teeth. They're a little different from the Ramfjord teeth. They're outlined over here. And when you look at these 6 teeth, again, you give them a score from 0 to 3. So if they have no debris or no calculus, you give them a score of 0. If they have lots, then you give them a score of 3. So there's a range. And so when we have lots of ranges, that's actually good. We know how earlier we were talking about sensitivity. So when there's lots of ranges where you can choose from, it's able to detect small changes. But sometimes when you only have 2 options to choose from, like a 0 or a 1, for example, then it's hard to detect small changes. So when we have lots of options like these, it's better because it's more sensitive. It's able to detect small changes. So let's say hypothetically, I am going to do let's do the debris index in purple. So I'll use purple. And let's say what I do is you look at the two all together. And let's say that on 1/6, there was a little bit of debris. Okay, so a little bit of debris. So I'm going to get 1. On 1/1, there was no debris. So when I say debris, I'm looking at plaque. On 2/6, there was lots of debris, lots of plaque. Okay, so here, let's say 0. I'm just looking at numbers here. Okay, so this is my debris index. Okay, so DI. This is DI. Okay, so DI stands for debris index. Let's do another one, and now I'm going to do this in blue. Now I'm looking at calculus. And so when I look at calculus, let's say that I'm going to do this on the inside just so we can differentiate. Let's say here I gave this a score of 2. The 1/6 got a score of 2 because there was calculus covering more than 1/3 of the tooth surface. So I did see a fair amount of calculus. On 1/1, I saw no calculus. On the 2/6, I saw, let's put 2 here. So I saw calculus, but it was just, it was covering more than 1/3, but not more than 2/3. So it was a fair amount, but not a lot of calculus. Let's say here, I saw a lot of calculus. Here it was just a 2, and here was a 1. Okay. Now what do? Well, for the debris index, what you do is you calculate, you add up all the scores, and you divide it by 6. So let's do that. So for the debris index, we have 1 plus 0 plus 3, that's 4, 5, 6, 7, 8. So we got 8. And it was 8. And then you divide it by 6. And then when you do that, I'll just show you in the calculator. So you take 8 and you divide it by 6, and you get 1.3. Then let's look at the calculus index. So when we're looking at the calculus index, I'm getting 2 plus 0 plus 2, so 4, 5, 6, 7, 8, 9, 10. So here I'm getting 10. and you divide it by 6. The reason why we're dividing it by 6 is because there's 6 teeth that we looked at. So when you do that, 10, I'm running out of space here, but you go 10 divided by 6 is equal to 1.7. I'm just going to round it up. I get 1.7. So what does this mean? Well, when you look at the debris index, 1.3 falls under this here, so it is considered fair. And when you look at the calculus index, you got 1.7. 1.7 also falls under this, so we got fair. So this person has fair oral hygiene. That's what you can say when you do the OHI. Now, if you wanted to do the OHI-S, this is where you're combining the numbers that you got here. So here, when you calculate the OHI-S, you go 1.3 plus 1.7. And again, this is, I know, easy math, but I just want to show you what I'm doing. 1.7, so you add it up and you're going to get 3. Okay, so when you get 3, this is also in this range here. It's just cutting it close. This is considered fair. So this person has fair oral hygiene. OH, fair oral hygiene. Okay, so that's how you calculate the OHI and the OHI-S. Next video, we'll look at how to look at gingival indices.